inspects the abdomen for shape and size.
So we can describe this abdomen actually as flat because it's not it's slightly protuberant, but it's still flat. The shape is round and it's appropriate for height and weight.
Auscultates for presence and activity level of bowel sounds in all four quadrants. Note for hyperactive, hypoactive, or absent bowel sounds.
So where do I start? Do you remember where I start?
Right.
Right lower
Yeah.
quadrant. So I started. So we're cutting the stomach right in half along the navel, and I'm listening for the clicks, gurgles, pops, all of that good stuff. And what I'm expecting to hear is what?
Some activity.
Some activity. How much activity?
I mean, decent amount.
All right.
Not too fast, not too slow,
Not too
or
fast,
not
too
absent.
slow. So all sounds. So the normal active abdominal sounds would be between 5 and 30. Less than 5 would be considered hypoactive. Greater than 30, hyperactive.
Palpates the abdomen for firmness and massage, noting if pain is elicited.
So you notice that I auscultated before I palpated. This is the only body system that we do that with. We always auscultate the bowel sounds first. Why is that? Because we don't want to increase activity.
Shake it up.
So I'm palpating lightly, and I'm asking the patient if they have any kind of pain anywhere.
Nope.
And I'm going to palpate in the suprapubic area and ask her if that gives her a sensation to void. Little bit.
Inquire regarding nausea, vomiting, indigestion, and discomfort.
Have you had any nausea, vomiting, indigestion, discomfort, diarrhea?
Nausea in the morning.
In the morning.
Inquires about the time of last voiding.
When's the last time you voided?
I voided roughly about an hour ago.
An hour ago?
or so.
Was there any smell to it? Was it clear? And was it painful?
No,
All right. How about your last bowel movement?
this morning.
How would you describe it? Was it solid, liquid?
Solid.
Solid, great. And do you usually have a bowel movement every day?
Yes.
Okay, great.
All right, inspects any tubes, NG tubes, G tubes, feeding tubes, equipment, or dressings of the chest and abdomen to ensure patency and proper function.
That's definitely something you want to do. Every time you go into a patient's room is the first thing you do is look at any tubes going in and coming out.
This is extremities. Palpates the radial pulses for strength bilaterally and equality of both sides.
Which side is the radial pulse?
Thumb side.
Thumb side. So I'm going to assess the radial pulse, and I'm actually going to assess the radial pulses bilaterally at the same time, because that can give me an indication of circulation. If one is stronger than the other, or if one's beat is different than the other.
Palpates hands for edema and warmth and assesses nail beds for color and capillary refill.
Nail bed's normal, there's no warmth. I'm gonna ask if there's any pain in this joint, in any of these joints. Good. I'm gonna ask you to squeeze my fingers, squeeze them tight, tight, tight. Good. I would say that her strength is equal bilateral.
Assesses range of motion of the arms and hands.
All right, go ahead and raise your arms up. Raise them, pull them to the side. Put your arms across your chest and put them back down to your side. Any pain with that movement? Good. And she is able to move against gravity.